Welcome to week 6 of the Nursing Leadership and Management course. The lecture for this week will focus on topics related to interpersonal skills. We will discuss team building and communication, conflict management, delegation, and managing personal and personnel problems. Before we start with this week's lecture, please take a moment to review the objectives for the class for this week. Think of a team to which you have belonged that operated smoothly and effectively. Group is a number of individuals assembled around some unifying purpose or relationship, such as the PTA or student in the School of Nursing. A team is a group of people with a high degree of interdependence and a focus on a specific goal or objective. It includes ongoing positive relationships and a supportive environment. Commitment is a passion for the project or mission of the team that allows team members to do whatever it takes to reach the objective. This can be seen in what is required to successfully achieve Joint Commission accreditation or magnet designation. Communication is the verbal and nonverbal interaction that occurs in the team. These interactions are respectful and honest, and members listen actively to the thoughts and feelings of other team members. Disagreements are handled in a way which honors each person and looks creatively for a win-win solution. Connectedness is a positive, supportive relationship that facilitates clear and effective communication. These are the main three foundations for creating a team. Some of the communication pitfalls include advice giving, making others wrong, defensiveness, being judgmental to others, patronizing, giving false reassurance, asking why questions, and blaming others. Can you think of examples you have experienced of each of these pitfalls? How it felt when these behaviors were exhibited to you? The following are attributes of effective and ineffective teams: working environment, discussion, objectives, listening, ability to handle conflict, decision-making, criticism, leadership assignments, feelings, and self-regulation. Some of the ways how to create synergy include a clear purpose, active listening, compassionate, telling the truth, being flexible, and committing to resolution. Synergy is created when team members work together to produce extraordinary results that could not have been achieved by one individual. In summary, we all work in teams. We all communicate. We need to be skillful at building teams and strengthening our communication skills. Some of the skills for synergy are self-appointed experts, someone who doesn't speak up, or a loner. The next topic for this week's lecture is conflict. The concept of conflict. The concept of conflict is neither good nor bad. Conflict is generally understood to be defined by various authors as a clash in individuals' or groups' values, differences in beliefs, attitudes, and expectations. Conflict can be more than simple disagreements. Conflict arises from a strong sense and a feeling of incompatibility. It represents an escalation of everyone competition and discussion into an arena of emotion or even hostile encounters that puts a strain on person or interpersonal tranquility or both. Conflict can be a strategic tool when addressed appropriately, and it can actually serve to deepen and develop human relationships. Some of the first authors on organizational conflict, that's Blake and Moulton, for example, they claimed that a complete resolution of conflict might not even be desirable and may in fact thwart the simulation of growth and change for the better. So why study conflicts? Usually conflicts is important to understand to maximize the strength within the group, learn more about what individual groups need, and to produce better outcomes. To better understand of stress and conflict, it is important to understand the several factors. Increasing our knowledge of the role stress plays within conflict is critical. Our society is known for being particularly stressful and stress-producing. We already know that stress leads to fatigue, which can lead to an increase in medical errors. Our culture within healthcare, furthermore, has been built upon a tradition of secrecy, shame, and blame when it comes to our failure to prevent medical errors. Gender differences exist and may at least partly explain why women are known for either avoiding or using compromise and why men may be known for aggressive techniques, none of which may completely solve a conflict. To understand the conflict process, we have to look at some factors. The longer ineffective actions continue, the more likely people will experience frustration, resistance, or even hostility. Frustration. Remember, when people or groups perceive that their goals may be blocked, they feel frustrated. This frustration may escalate into a strong emotion, such as when people become angry or just give up. When the patient does not carry out his or her part of the plan, we label this patient as non-compliant and feel frustrated that the patient is uncooperative, when in all likelihood the patient had a completely different set of priorities at the start from those of the nurse. At the same time, the patient might view the nurse as controlling and insensitive. When such frustration occurs, it is a cue to stop and clarify the nature of major differences and make sure everyone is on the same page. Conceptualizing is part of the conflict process. I like the idea of the snapshot image. For example, when we see or are confronted with something, our mind forms a mental judgment about what actually happened. Everyone involved has an individual interpretation of what the conflict is and why it's occurring. Most often, these interpretations are different and involve the person's own perception or perspective, which is based on personal values, beliefs, and culture. Regardless, conceptualization forms the basis for everyone's reaction to the frustration. The way the individual perceive and define the conflict has a great deal of influence on how creative those involved may be in trying to resolve the problem and what type of outcomes can come about. For example, with the same conflict situation, some individuals may see the conflict itself as very threatening and may label everyone involved as insubordinate and become so angry at the threat to his or her role that he or she falls back upon rigid adherence to policy and procedures. Others may view conflict as trivial bickering and become critical of everyone involved, as in, we've been over this subject already, why can't you just drop it, and complain or withdraw. Such differences in conceptualizing the issue block its resolution. Leaders has to get everyone in clearly state the conflict as I see it and how it makes me feel before they can define the conflict Action. Did you ever notify or notice that once there is an accurate or agreed upon idea of what the problem is, the strategies, plans, and behaviors seem to just flow right on out? As actions are taken to resolve the conflict, the way that someone or all parties conceptualize the conflict may change. The important point is that people are always taking some action regarding the conflict, even if that action is avoiding it or deciding to do nothing. The longer ineffective actions continue, the more likely people will experience frustration, resistance, or even hostility. Outcomes are part of the conflict process. Outcomes is another word or for consequence or results from whatever actions were taken in any given situation. The conflict may be resolved with a new plan that incorporates the goal of two or more people to ensure that no one loses. Productivity and efficiency may increase, decrease, or stay the same. Emotions may be high, and anger and resistance may remain, resulting in further conflicts. Then, what about ugly behaviors? The use of the term ugly refers to attempts to downplay and pretend conflict doesn't exist. It was used by the author Bacall, B-A-C-L, in 2004. There are four strategies. Ugly strategy 1, non-action. Did you ever come in contact with someone who pressures staff to smile and nod when asked if everything is okay because he or she doesn't really want to know? This is called non-action, because nothing is really done about a problem when the leader doesn't want to hear about it. Such behavior can actually become part of the organization's culture to behave this way. In ugly strategy 2, administrative orbiting, another common way for managers to avoid conflict in the workplace is to not respond to it. They may actually ignore colleagues' attempts at professional communication in voicemails or email messages, or make a habit of canceling meetings. Worse, if this behavior is known by his or her leader and continues, the avoiding behavior is said to be endorsed or approved. In another example, a leader may make mention of another team member's failure in a particular area while remaining silent about another's well-known transgression, easily giving rise to a distressing double standard. In ugly strategy 3, secrecy is another means of getting around conflict is having secrets. There are some managers who don't let people know where they are during the day. They might have plenty of so-called backstage discussions about rather than with the involved parties and play favorites, all of which all amount to scenarios with a high potential for fueling rather than dealing with the actual conflict in the first place. In the ugly strategy 4, law and order, a most unfortunate choice, yet one painfully recalled by anyone who has ever worked as a staff nurse, in the leader who relies on regulations, power, policy, and procedures. This is the person who can quote line and verses of policies, sometimes in a quiet, sympathetic tone of voice. Gosh, I'm sorry, but there is a policy that covers that, or even, we can't even go there. What would XYZ think of us? This behavior is destructive because it thwarts health discussion and challenges to the status quo. The manager who uses it most frequently think that by quoting line and verses, conflict will actually go away. The more the action appropriately matches the nature of the conflict, the more likely it will be resolved with desirable results. Look at the case study on this slide, the case scenario. In your opinion, which ugly strategy is involved in this situation? Administrative orbiting. Were you able to pinpoint this behavior? How is this behavior destructive to actual progression toward goals? How does this behavior actually contribute to conflict and stand in the way of healthy conflict resolution? There are 5 modes of conflict resolution. Those are avoiding, accommodation, competing, compromising, and collaborating. Avoiding or withdrawing is a very unassertive and uncooperative. Yet, many times we choose to avoid deliberately, thinking that getting along or staying out of it is always the better option. Sometimes, and only sometimes, it may be a preferred option. Would you like to give an example of what you have seen in the clinical area recently that would illustrate this point? The authors here say that when we overuse accommodation or smoothing behaviors, we tend to neglect our own needs, goals, and concerns, which is unassertive. While we try desperately to satisfy those of others, be viewed as cooperative, this approach has an element about it of being self-sacrificing and putting ourselves and our needs last. Again, this isn't a bad thing unless it is done all the time to prevent conflict resolution. During competition, people pursue their own needs and goals at the expense of others. Me first. Sometimes people use whatever power, creativeness, or strategies are available to win. Competing may also be a good thing, such as when standing up for your rights or defending important principles, such as when we advocate for safe staffing levels, defend a colleague, or try to expand financial resources for nursing education and research. However, people who are very skilled at competing may begin at some point to fail to hear the truth or not have much tolerance when others disagree and challenge them, even when they are wrong. They often react by feeling threatened, acting defensive or aggressive, or even resorting to cruelty in the form of a razor-sharp remarks. Competition within work groups can generate ill will, favor a win-lose stance, and commit people to a stalemate. Such behaviors force people into a corner from which there is no easy or graceful exit. Compromising or negotiating involves assertiveness and cooperation on the part of everyone and requires maturity and confidence. It is a learned skill developed over time. A give and take relationship results in conflict resolution, with the result that each person is able to meet his or her most important priorities as much of the time as possible. Compromise is often described as a middle ground, and the successful leader invites everyone to join in. This is the preferred mean of conflict resolution during union negotiations, in which each side is appeased to some degree. In this mode, nobody gets everything they think they need. Yet there is a sense of energy that is necessary to build important relationships and teams. Compromise supports a balance of power between self and others in the workplace. The fifth mode of conflict resolution is collaboration. The opposite of both avoiding and competing is the most creative stance. It is both assertive and cooperative because people work creatively and openly to find the solution that most fully satisfies all important concerns and goals to be achieved. Collaboration involves analyzing situations and defining the conflict at higher level where shared subordinate goals are identified and commitment to work together is generated. For example, When nurses and physicians work together, they can collaborate by replacing the statement, I am in charge, with what is the best thing we can do for the patient and family right now, or how does each of us fit into the plan to meet their needs. This requires discussion about the plan's superordinate goals, how it will be accomplished, and who will make what contributions toward its achievement and proposed outcome. The same scenario fits for patients and families. Compromise supports a balance of power between self and others in the workplace. There are many things to think about and consider when selecting an approach to resolve a conflict. Nature of the differences, underlying reasons, importance of the issue, strength of feelings, commitments, and goals involved. Preferred and previously ineffective approach can be considered, but they need to match the situation. Not everyone has the same experience nor the memory of the same conflict. Sometimes a third party may be introduced into a conflict so that mediation can occur. Mediation is a learned skill for which advanced training and or certification is available. The mediator is usually an impartial helper who assists each party in the conflict to better hear and understand the other. Mediation is not so easy. In our American society, for example, there is much focus on who can control whom and a lot of emphasis on winning. The successful individual involved in conflict resolution and negotiation often moves beyond winning and even beyond avoidance, accommodation, and compromise, which are more about trying not to disturb the status quo. In the nursing practice arena, there is often the added difficulty in negotiating conflicts when at least one of the parties, which has historically been the physician when it comes to quality of care issues, is viewed to be or views himself or herself on an unequal or uneven playing field. Some of the techniques for irresolvable conflicts is polarity management. The objective of polarity management is to get the best of both opposites while avoiding the limits of each. In other words, once people determine their conflict is a polarity, they can act to maximize both poles' upsides and minimize both poles' downsides. This is called polarity management, which requires a shifting focus from pole to pole when the leader, acting more as a coach in these instances, sees that there are some downside consequences about to occur. The key, just like for coaches at a football game, is to sense oncoming downside consequences or to be sensitive to feedback that there are negative consequences occurring, then take actions toward the opposite pole. Take a minute to review this case study. Todd Johnson task is to introduce key elements of the Saving 100,000 Lives campaign of the IHI to his institution. Half of the team report to the nursing department while the other half report to various vice presidents and physicians, with all sides blaming each other for recent failures. To maximize the success, illustrate that no one plan is right. With a diverse group, Todd ought to acknowledge contributions unique to each member. You should use both and rather than either or language. And difficulties are certain to be ongoing, so that is that should be an expectation. Some of the ongoing assessment strategies for success include understanding your own approaches to conflict. Conflict may be resolvable or unresolvable, and they are common in healthcare and when dealing with people in everyday life. To resolve conflicts, we need to identify differences, priorities, and common goals. We need to determine which approach to conflict is most appropriate, and last, we need to act in that way to resolve it. When conflicts involve polarities, all parties need to analyze their structure and dynamics, identify ways to shift emphasis among opposite poles, and partner with others to bring about the most satisfactory conclusion. Finally, we need to recognize that the people who occupy leadership positions on our own institution's table of organization may not be the best people to demonstrate or coach us in conflict management. We need to understand and recognize that very often our leaders exist within other settings as well. Have we considered our professional organizations or specialty association as places to go to link up with nurse leaders? In conclusion, learning about conflict is actually a lifelong journey. None of us is perfect at handling conflict all the time. In every situation, we have difficulties. Therefore, we all have something to learn. We're going now to discuss the concept of delegation. One of the expectations of professionals is that they know how to delegate work in such a way that they are effective and more work is done in a timely manner. That is what we are about to look at now. There are several things to consider when making a decision about delegation. They can all be summed up in these questions: why to do it, when to do it, who to delegate to, how to do it, and what to consider in delegation. The biggest question to answer is why delegate? If you are able to accomplish all of your work in a reasonable time, why would you want to delegate? Some possible answers are to spend more time with patients, to use time to research best practices, to make time available to work with other challenging patients, to increase skills in holding others accountable, and in communicating what is needed for patients. Few positions exist in most healthcare organizations where delegation isn't a needed skill. When to use delegation? Obvious times to use delegation are when you clearly cannot provide all of the care to assigned patients, when the delegatee is highly competent in various tasks that represents a portion of the care your patients require, or when you are ensuring care for another group of patients, such as when a colleague is away from the clinical unit. Who to delegate to? Basically, registered nurses work with two types of people to whom they can delegate nursing tasks. They are licensed practice or vocational nurses, called different names based on the state of practice, and unlicensed nursing personnel, who are also known by various names in different states. Remember that the delegating professional remains accountable and that person cannot delegate a patient to another, only a portion of care. As a result, knowing those with whom you work is really critical to successful delegation. Who are they? There are several important facts and views to consider about the person to whom you may delegate something. The best two indicators to start with relate to what the organization policy is regarding delegation. If the organization makes clear through policy that delegation of certain tasks is unacceptable, it is important to know that before you are in a situation where delegation is possible. The next thing to know is to know what the position description for a given person is and if there are any exceptions. For example, an LPN might be in a peer assistance program and unable to administer medications, even though the position description may indicate that such is possible. Some institutions provide great detail about tasks unlicensed assistant personnel may perform. Other institutions speak in generalities about performance. Next, it is important to know how specific individuals perform and what other responsibilities they have. You won't be delegating to a position, you will be delegating to a person. Once you know that someone is trustworthy and available, the next thing to consider is the individual's knowledge, skill, and attitude in relation to the tasks you are assigning. This does not mean that you will assign only those tasks that someone else wants to do. What it does mean is that you may need to provide greater supervision for some aspects of care. How to delegate? The approach to delegation depends on whether an individual is assigned to work with you or whether an individual is working with a group. State the patient's name and room number for whom you are making an assignment. State what task is to be performed and validate that the delegatee is able to perform this without supervision. Provide timelines, when, time range, frequency. Detail any specific approach to be used. Set reporting parameters, when, how, and under what circumstances. If you are working with an individual who is assigned to work only with you, you know that what that person is involved in and you can convey what to report throughout the day. If you and others are working with an individual, you may need to negotiate with someone else for time when the individual delegatee can work with you. It is not likely that the person will be communicating with you throughout the shift because he has many or she has many other people with whom he or she is working. If such is true and you really need help monitoring a particular patient, ask the delegatee to call you immediately if he or she notices specific behaviors while passing by this particular patient's room. In this way, you are expanding the watchfulness for a particular patient, even though there is an insufficient assistive staff to work directly and only with you. What to consider in delegation? Things to think about including the following: how long the person has worked with a specific patient population, whether this person is an organizational employee or contracted employee, what is happening in the larger context of the person's life, is delegation safe for the patients? Remember that the bottom line regarding delegation is safe patient care. The context of the organization may include examples like hospital, ICU, community clinic, rural hospital, larger healthcare organizations. Delegation happens differently in different organizations. For example, in a hospital ICU where staff may be stable and most care is visible from many vantage points, delegation is easy to implement. The delegator can see what the delegatee is doing. In a community clinic, however, the number of professional staff may be very limited and the opportunity to see what any one delegatee is doing is unpredictable. In this type of situation, it is very important to know what the skills and abilities of each staff member are. Same thing applies to rural hospitals or larger organizations. Proper delegation has many benefits for nurses. Delegatees do not substitute for professional nurses. They do expand the nurse's availability for the work that only a registered nurse can do. It saves time and it saves strategy. It's a saving time strategy. The next topic for today's class is managing personnel and personnel problems. Working with people is the greatest challenge in the workplace. Most of the time, a new graduate nurse will not be expected to handle people problems alone. However, awareness of problems is critical, and a new graduate must think of how to relate to such situations, including what the responsibilities are for reporting and follow-up in each situation. Excessive absenteeism can be a reflection of role stress and is reflected in behaviors such as withdrawal from interaction, reduced involvement with colleagues, decreased commitment to the mission of the workplace, and job dissatisfaction. Often, a reminder or clarification is all that is needed for discipline of a staff. Some of the non-punitive discipline review-related policies, reminders of the goals, and having discussions. And if step 2 is ineffective, give a day off with pay for the employee to reflect on whether they choose to work in the facility. And often a reminder of conflict or clarification of a problem is all that is needed. An example of violation of policies or standards is absenteeism. Can students see how this approach can work for employees with excessive absenteeism? Without compliance with the standard, the result is termination. If employees agree to the standards and then fail to adhere, they have essentially terminated themselves. Uncooperative and unproductive employees. Two key issues related to these types of employees: motivation and ability. Motivation refers to attempting to determine the cause of the problem and working to provide a positive, upbeat environment that is more conducive to employees becoming motivated. Ability can be identified by frequent errors in judgments or technique that indicate a lack of knowledge, skills, or critical thinking. Specific behaviors or trends in behaviors can help identify where additional training and support is needed to improve skills. Immature employees can be identified through defiance, passivity or hostility, or negative judgment. It is important to confront the employee with the behaviors that are inappropriate and set limits and consequences for their behaviors. The leaders or the new staff nurse is not a professional therapist. Utilize employees assistance program, the EAPs, or some other sources through human resources to deal with employee with emotional problems. Employees with emotional problems can talk about them for hours with a new staff nurse, which can compromise patient care. New graduates need to develop strategies of how to handle such situations. Seek professional help. Dealing with employees who have chemical dependency. Patient's care is in jeopardy when a nurse has a chemical dependency. Think about the responsibilities of a staff nurse when chemical dependence behaviors are observed and what action should be taken. Human resources need to be actively involved in these situations. The State Board of Nursing is usually advised and the nurse must get treatment. Documentation of incidences or coaching patients with issues that are mentioned earlier like chemical dependency or emotional problems is very important. Having written documentation is crucial. These issues cannot be left to memory. What is helpful, particularly with employees who would report to the new nurse, have a discussion of these events with the nurse managers or leaders.